After the First World War, Shandor decided that society was too sick to survive.
Most people don't associate habits like social drinking and coffee consumption with wrinkles, black marks under the eyes, white marks on nails, and hundreds of other subtle health indicators. Instead, they associate those indicators with the gradual symptoms of aging or even as a more acute occurrence. They consider those symptoms merely normal and don't correlate them with the snapshot in time, blood serum results and other measurements doctors utilize in a typical Western medical practice. For instance, X-rays can reveal physical damage to an organ, but an organ that looks normal on an X-ray might still be underperforming due to nutritional deficiencies. A blood test may show normal results from that specific blood lab. They all have their own parameters based on statistics, but they may not be typical for your situation, especially when compared with other countries. These statistics, usually used for determining if a blood work lab result is normal or not, is called a reference range. They test virtually no nutrients in your body this way, and if they do, it's usually vitamin B1, 2 and perhaps vitamin D, but many medical bureaucracies have been cutting funding over the decades, and thus rarely test even those. Researchers have discovered distinct changes in the body that signal a lack or excess of certain nutrients. By analyzing this body language, they can accurately identify deficiencies or surpluses of specific vitamins, minerals, proteins, and other essential elements. This technique is called nutritional symptomatology, which focuses on interpreting physical indicators to reveal the underlying causes of these imbalances. Ancient Indian Ayurvedic researchers and 1950 Saskatchewan, Canada orthomolecular medical doctors have identified specific changes that occur in the body when there is a deficiency in certain nutrients. By examining this body language, it becomes possible to pinpoint deficiencies or excesses of particular vitamins, minerals, proteins, and more. This approach is commonly known as nutritional symptomatology. It involves interpreting physical signs to uncover the root causes of these imbalances. This method is particularly valuable for identifying subclinical deficiencies that may not be detected through standard laboratory tests. It's important to clarify that in this context, symptomatology pertains to the analysis of nutritional imbalances rather than disease symptoms. Every individual possesses a unique biochemical makeup, just as our fingerprints, voices, and physical appearances vary. So too do our nutritional requirements. Each body responds differently to the same dietary intake. Our distinct metabolisms lead to varying needs for nutrients. Certain foods and supplements might be absorbed at different rates, either too quickly or too slowly. Additionally, some nutritional elements may be nearly absent from our systems, while others might be produced by our bodies in sufficient amounts, rendering further intake unnecessary. Nutritional symptomatology serves as the most dependable method for assessing an individual's nutritional status. It highlights deficiencies that can be addressed through dietary adjustments or food supplements. By conducting these evaluations periodically throughout a nutritional program, we can effectively monitor a participant's progress. This method offers deeper insights than traditional food consumption surveys. Evaluating dietary intake frequently misses essential elements like soil health, timing of harvest, pesticide application, and cooking techniques, all of which can greatly influence the nutrient levels in the plants we consume. Additionally, these assessments fail to account for the significant variations in nutrient absorption among individuals. What we consume may not correlate with what actually benefits our bodies. Furthermore, some individuals might require several hundred or even thousands of times more of a specific nutrient than what conventional experts deem necessary to avoid mortality. Laboratory tests. Nutritional assessment is often more accurately gauged through symptomatology than through traditional laboratory tests, which mainly aim to identify significant pathologies. For instance, X-rays can reveal physical damage to an organ, but an organ that looks normal on an X-ray might still be underperforming due to nutritional deficiencies. Many individuals undergo blood and urine tests that indicate everything is within normal limits, yet they still experience pain, mental fog, fatigue, or a general sense of mild to moderate discomfort. Why does this happen? The body's blood and tissues constantly works to maintain balance, often doing so even in the face of serious health issues. This effort to achieve homeostasis can come at the cost of other tissues and glands. For instance, 1. Blood calcium levels might appear normal, even as dental issues and osteoporosis develop. The bloodstream prioritizes calcium so much that it leaches it from bones and teeth. 2. Blood tests may show normal levels of zinc and vitamin B6, while the individual still suffers from symptoms largely from deficiencies and dependencies that are frequently dismissed by conventional practitioners. The MAW factor, or crypprol, produced by some under stress, binds these nutrients and hinders their use in the body. 3. There can be sufficient thyroid hormone in the blood, yet it may not reach the tissues that require it, as this hormone is not primarily distributed through the bloodstream. Constituents of urine constantly change, fluctuating with the food or fluid intake. As an example, the body uses large amounts of vitamin C under stress conditions. Thus, it may not have any excess vitamin C to eliminate in the urine under stress, but will do so quite freely in normal circumstances. A similar relationship applies to the B-complex vitamins and zinc, which are also water-soluble. The body also eliminates excess sugar or protein through urine. Therefore, urine samples taken at different times of the day, or at varying intervals, may not be reliable indicators for nutritional assessment. On the other hand, hair analysis is mainly effective for identifying levels of toxic metals and potential mineral imbalances. However, it does not provide insights into vitamins, proteins, or organic functions. Additionally, the mineral concentration in hair may not accurately reflect levels in other tissues. For instance, if hair analysis reveals high lead levels, it raises the question of whether the lead came from dietary sources, or if it accumulated due to environmental pollution. Due to certain limitations, relying solely on laboratory methods can lead to misleading results. While lab tests can yield highly accurate measurements, the importance of these numerical values isn't always clear or applicable. In contrast, nutritional symptomatology serves as a more approximate measurement tool. Individual signs associated with specific nutrients may also stem from other potential causes. However, recognizing a consistent pattern can be quite meaningful, particularly if an individual exhibits multiple related symptoms, pointing to the same underlying issue. In the realm of nutritional assessment, being roughly correct is often more valuable than being precisely wrong.